Testing, testing. Good morning, everyone. We'll go ahead and get started. I want to first just welcome everyone this morning. This is the first seminar that the chapter of PHI Lambda of Alpha Phi Alpha Fraternity Incorporated has done in the area of Medicaid, Medicare, and wellness. So I want to welcome everyone out this morning. I want to ensure that everyone leaves here with some valuable information, some information that can change their lives, enable you to get better benefits, enable you to have a healthier lifestyle. That's the whole point of this seminar. I also want to let you know that we'll be streaming live this morning on Facebook. I'm sorry, YouTube. So be mindful of that. Without further ado, we'll go ahead and get started with our presentations. This is our seminar, Medicaid, Medicare, and Wellness. This is a seminar we're doing in conjunction with Humana, and we have a few other partners in the house. First of all, the objective of this seminar is to provide the public with the necessary tools to live a long and healthy lifestyle. We want to do this through presentations and our brief Q&A session. We hope that everyone leaves today with getting the tools that they need to make quality decisions about their medical and wellness needs. Our first presenter is going to be Medicaid, Ms. Haley Shafate. One second. Okay. Next presenter is going to be Humana. Let's see if I got it. We have Ms. Sherry Monet. Centerwell, unfortunately, Centerwell couldn't make it this morning. And then our next presenter is going to be Canopy Counseling and Consulting Services, Ms. Stacy Williams-Whiteside. And please forgive me, but Oshner and Karen? Ms. Karen St. Pierre will be speaking with us from Oshner. Okay. I'm getting ahead of myself. Pastor, can you come and lead us in prayer?
Let's bow our heads in a moment of prayer. Heavenly Father, we come to you on this day, God, first giving you praise, glory, and honor for who you are, God. Father, we thank you right now for this day, God, that's been upon us since the beginning of time. Now, God, we thank you for each and every presenter that is here, God, that you would just bless them for this seed of time, this seed of love to come speak into the lives of your people. Now, Father, we ask for traveling grace for all those that are traveling through the weather this morning to be here. We're thankful for those that have made it. So, God, we thank you that when it's all said and done, God, that there will be no hindrance to any information that you have assigned for your people to have on this day. And in the end, God, we believe that you'll be glorified, your people be edified, the enemy will be horrified, because his works have been destroyed and your people have been blessed. And it's in Jesus' name we pray. Amen.
Good morning. Thank y'all so much for having us today. I am the administrator with the Region 9 Medicaid office. Now, when we say Region 9, that includes St. Tammany, Washington, Tangipahoa, Livingston, and Tangipahoa Parish. Our local office is located in Hammond. That is the regional office. But the good news is you no longer have to take an hour trip. There's so many other options that you can do if you have Medicaid questions or wish to apply. Today, I just kind of wanted to go over a little bit of information and discuss what Medicaid is, how you apply for it, what would make someone qualified for Medicaid. And on the flip side of that, I also want to talk to anybody that already has Medicaid and explain some upcoming changes that we're fixing to have. So we'll start off with just a brief overview of the Louisiana Medicaid program. Some people may ask, well, what is Medicaid? Medicaid provides medical benefits to our low-income individuals and families, and although the federal government monitors and they establish some of the rules, it is facilitated by the state, and we work under the Louisiana Department of Health umbrella. It's estimated right now that over 2 million Louisiana residents are currently certified for Medicaid, which is about 44% of our state population. And just to break down a little bit of the statistics further, 1 out of every 2 children in Louisiana and individuals with disabilities are currently certified in Medicaid, and about 3 out of every 4 of our Louisiana nursing home residents have Medicaid. This map just breaks it down for percentage by population for each parish, and as we can see, St. Tammany Parish has about 30 to 35% of its residents currently certified for some type of Medicaid program. Now, when someone first asks about, well, I want to see if I qualify for Medicaid, the first thing that we're going to look at, we have certain things called categories of eligibility, and we have categories such as aged, and when we say aged, we're talking about anyone that's age 65 or older, blind, disabled, or our MAGI groups. It used to be called our children's group, but since Medicaid expansion happened, it also includes some of our younger adults, our pregnant women, and any households with children. There's also a category that is run by a specialized unit for if anyone's looking for long-term care placement, either in the nursing facility or if they're looking for some type of waiver services that we would look at. For a certification period, generally Medicaid starts the first month of the date of the application, and it generally runs for a period of 1 year. During that 1 year, though, when you sign for an application, you agree to report any changes that happen during that year, whether that be an income change or if someone moves out of the household. There are, however, some programs that allow for a 3-month retroactive period, meaning that if you applied in 1 month, we may be able to begin your coverage and backdate it 3 months prior. Now, how to qualify for Medicaid? There's several factors. The first thing, of course, you need to be a Louisiana resident. You need to have, or at least have applied for a Social Security number. You need to be a U.S. citizen or a legal alien. You would agree to an assignment of rights for medical support and payments from third parties. And depending on which program, because there's 20+ programs that we look at, some of the programs don't allow for any type of private health insurance. But in addition, and the big thing is, you would have to meet an income. Medicaid, sponsored by the state, ran by the state, it is an income-based program for our lower income families and individuals. If you are in the age, blind, and disabled category, there's also something called a resource limit. Resources are things you own, such as an extra vehicle, bank accounts, things like that you have to follow and meet that requirement as well. But one thing to note is for some people that have lower incomes, they have like lower Social Security amounts and they qualify for Medicare, we do have Medicare savings programs that may help you pay for your copays and deductibles, and those no longer look at resources. Now, I'm not going to go through the entire income limits chart with you. I just kind of want to show a snippet of it to say that every Medicaid program we have has a different income limit. It depends on what category you fall into. It depends on your household size. So if someone comes up to us and they say, hey, what's the income limit for Medicaid? We're not going to be able to give you a simple answer because it just depends. Every situation's different. And I show these two cards a lot of times. You know, one of the hardest things is for people to know the difference between Medicaid and Medicare. The blue and white card from the Department of Health and Hospitals you see on the left, that's a Medicaid card, and that's what the state runs. The red, white, and blue card is a sample picture of the Medicare card, which many of you have when you pay into Medicare and you get your Social Security. Okay. Some of the Medicaid core services that we have, generally if you're in a full Medicaid program, you're going to have your doctor visits, you're going to have your hospital stays, your prescriptions, but we also have other things like non-emergency medical transportation services, hospice services, family planning services, and depending on which health plan you have, you may be able to qualify for some assistance with dental care and vision. Most of our Medicaid members that are found eligible for Medicaid have benefits through a health plan. We currently have 6 health plans offered in Louisiana, and each member is allowed to choose their health plan. They basically offer the same basic benefits, but they have different provider networks and may offer a few extra wellness benefits depending on which plan you choose. Many times we do have clients and members that come in and say, well, which one's the best? We're not allowed to say which one's the best. This is what we always suggest. If you have no idea which one you want to go with, if you already have a primary care provider or a hospital or specialist that you like to see, ask them which one they accept. And if they accept 2 or 3, then you can contact them or look online, do a little research, and determine which one offers maybe an extra benefit that you'd be interested in. We also have, depending on the program that you're found eligible for, 2 dental plans that you can choose from. Now, how to apply for Medicaid. You don't have to worry about taking a picture or memorizing all this information. I have some cards out on the table for you that will have all this information. Like I said, our office, the regional office that includes St. Tammany Parish, is located in Hammond. You're more than welcome to come see us there, but there's no need now. Everything can be done online, by telephone, and if you just prefer something written, a paper application in the mail, we can send that to you as well. Now, for anybody that likes access to things on their phone or online, we do have a great self-service portal. If you create an account and you use the self-service portal, you can do anything from applying for Medicaid, you can see about your benefits, you can request an additional Medicaid card because maybe you've lost it, or if you just need to make changes, or for any reason somebody calls you and say, hey, we need additional information for us to continue your services, you can upload your information from the self-service portal. Now, I talked about, we have blind, aged, and disabled groups. We have the children's groups that we talk about. But anyone that's interested in long-term care, we have a specialized unit. They work out of Opelousas, but you can call them toll-free. And even if you called us, we could put you in contact with them. They work specifically on anyone that's going into a nursing home or looking for some type of waiver services. I do want to shift focus. This was more about talking a little bit about a brief introduction into what Medicaid is, but something is happening now where we're going back and looking into renewals. So I kind of want to explain what's going on with that. You might have seen a lot of big billboards going on, or maybe even seen a TV ad about Medicaid and making sure you update your contact information. In March of 2020, we all know when COVID hit its peak, we went into a public health emergency. And during that time, we stopped closing anyone for Medicaid. We didn't want anyone because they had lost their job or anything, or maybe had to move or live with a family member to lose their coverage. But the recent passage of the Consolidated Appropriations Act, it ends this requirement for us to no longer renew coverage. So as a result, beginning this month, we are starting the renewal process for Medicaid again. This is just a brief snippet of our timeline, but what I want to make everyone aware of is the first renewal letters went out with the date of May 1st, so they're starting to roll out. But just because your friend or your neighbor may have received their renewal doesn't mean your renewal is going to come due this month. Again, we have over 2 million residents currently on Medicaid. We couldn't possibly review all of that coverage in 1 month, so it is being staggered over the year. So if your neighbor says, hey, I got my Medicaid renewal in the mail and I've already got it done, and you haven't received yours, don't panic yet because it might not have come due yet. Now, when it's time for a Medicaid member's renewal, a couple of things happen. First, what we do is the system runs against certain interfaces to see if we have enough information without even having to ask you for further information. If we can do it based off of the information that we have, we go ahead, renew your coverage, and send you a renewal letter, and that's called a streamlined renewal. But oftentimes, if the system butts up against something and it needs maybe some income verification or anything like that, then a renewal letter will be sent out to you requesting specific information and asking you to complete your renewal form. These are just some of the interfaces that we get information from. We have shared information. We can get information from the Social Security office, food stamps office, and even the federal marketplace. Really, with the billboards and everything you're seeing right now, what everybody's doing, because 3 years is a long time and a lot can happen in 3 years. So what we're trying to make everyone understand is it's so important to update your contact information with us. People move in 3 years, people's phone numbers changes. And another urgent thing that we're trying to get is we're trying to get people's cell phone numbers and their email addresses. In addition to phone calls, we're now doing a text system to tell people, hey, it's time for renewal. Remember, it's time for you to do your renewal, or hey, we're trying to contact you, and we're also sending out emails as well. The thing that it's important, there will be people that during COVID that went back to work and they're no longer eligible for Medicaid. We realize they will correctly lose their Medicaid coverage, but what we don't want to happen is someone who really is eligible to lose their coverage just because they didn't have an opportunity to renew because we couldn't find them. So key messages for Medicaid members: we started renewals again. It's important to update your contact information with us, and if you receive anything in the mail, please respond to it. Thank y'all so much for having us. Again, we're going to be in the back at the table by the balloons. If you have any questions, please feel free to see me.
Everyone, if you have any questions, we're going to pass out some cards that you can write your questions on, and we're going to have a Q&A session at the end. The next presentation is going to be by Humana, Ms. Sherry Monet.
Good morning. Thank you all for coming out. What I'm going to do is kind of piggyback on some of the things that were just mentioned and speak about how when you have Medicare, what options you have in addition to being on original Medicare. There we go. Sorry about that. I'm going the wrong direction. Okay, so first we're going to go over who is eligible for Medicare, discuss Medicare enrollment periods, understanding Medicare options, and then some additional resources. So basically, you are eligible for Medicare, original Medicare, which is generally parts A and B, when you're at least 65 years of age, or if you're under 65 and qualified due to a disability or other special circumstance. Also, you're a U.S. citizen or a legal resident who has lived in the United States for at least 5 consecutive years. Medicare enrollment periods. So there are a couple of different enrollment periods. Most folks, the first enrollment period that you have is when you turn 65. So you would be eligible to enroll in Medicare Parts A and B. If you're enrolling for the first time, you have an IEP, which is your initial enrollment period. It begins 3 months before and ends 3 months after you turn 65. It begins and ends 1 month early if your birthday falls on the first of the month. So basically, you have a 7-month period in which you can enroll and be considered a timely enrollee onto Medicare. Sometimes there's some differences if folks are still employed at that age. So you may get on Part A, you may postpone Part B because you're still employed. So there's some different variables there, but for the purposes of this discussion, for most folks, when you turn 65, you've got 3 months before the month of your birth date, 3 months after, and including that month to get enrolled and be considered a timely enrollment. Let's see, you may enroll in Part A, Part B, or both. You may also choose to enroll in a Medicare Advantage plan Part C or a prescription drug plan, which is Part D. Although you are not required to enroll in Part D, there is a penalty of 1% of the average monthly premium for each month you delay enrollment. And then, so with Humana, with Medicare Advantage, I work for Humana under the Medicare Advantage portion. Part C is a Medicare Advantage plan. So in October, November, December, when everyone was seeing all those commercials, by all the different celebrities, trying to get you to call to see if you wanted to change benefits or if you were missing out on benefits, those commercials are trying to get you to look into Part C plans that are being offered. So I'm sure everyone was inundated with those commercials during that time. With the Part D benefit, again, it mentions that you're not required, but it really is important that even if you're not on medication at the time, that when you first become eligible for a drug plan, that you get on one. Because what happens is if you wait until you actually need that particular drug plan, like with any insurance, the longer you wait, and if you try to get the plan when you now need it, there's penalties in place. So that would be added to your monthly cost when you now need medication. The next annual enrollment period would be what they call AEP, and that's October 15th through December 7th. And again, that's when you see all those commercials rolling, because this is when anyone who has Medicare, Parts A and B, can elect a Medicare Advantage plan. So if you already have one, you can make changes, you can drop, but this is that time where whatever you've elected, if you want to revisit and see if you like where you are, if you want to see what other plans are offering, this is the time that you can do that. So you would do that between October 15th through December 7th, and that effective date would be January 1st of the following year. There's also a special election period. So the special election period is going to be outside of that date. You may be eligible to change your Medicare Advantage plan due to special circumstances, like being diagnosed with a qualifying chronic health condition, moving to a new area, qualifying for extra help, or retiring or losing your employer coverage. So with Humana, we also have an additional special election period. We have a 5-star rating with Medicare. So what that allows for is outside of the traditional enrollment periods, if a member wanted to get onto a Humana plan, they have that one additional special election, which is called a 5-star election, where they could make a move outside of the normal plan change, and that's only one time in a calendar year. So the first step, you enroll in Original Medicare, and that's offered through the federal government, as was on the previous presentation. So that is what the Medicare card looks like. So if you have Medicare, Parts A, Part B, A and B, you're going to have a card like that that has Part A and the effective date that started, and then your Medicare Part B and the effective date that started. In the past, some folks have had really old cards. It may be your Social Security number, but that was changed years ago. So now you have an original number that's listed as your Medicare number. So if you have Parts A and B, you would then be eligible for a Medicare Advantage plan. So Part A helps pay for hospital stays and inpatient care. Part B helps pay for doctor's visits and outpatient care. So once you've become effective on A and B, you then have an option to join a Medicare Part C plan, or you have an option to purchase a supplement. With a Medicare Part C plan, you would continue to keep your Part A and your Part B. Many folks don't pay anything for Part A, and there may be premium for Part B. Some folks, if they're on Medicaid, they may not be paying for either, but they would be still eligible to get on the plan, a Medicare Advantage plan. Most of our Medicare Part C plans include a Part D, D for drugs, so that would include your drug coverage. So if you're on Medicare Parts A and B and you elect to get on a Part C plan with Humana, most likely you're going to have the coverage for hospitalization, doctor's offices, and then the Part D includes your drugs, and that's all in one plan. The other option that you have is to not get on the Medicare Part C plan, but to get on a separate supplemental plan. A Medicare supplement, also known as Medigap, it's a plan that helps pay for some of Original Medicare's out-of-pocket costs. And that generally works like secondary coverage. So So you would still have your A and B coverage. You would utilize your A and B coverage, and then sometimes you have leftover amounts or balances. You then would submit that to your Medicare supplement plan, and it may pick up additional cost. So Medicare supplement plans generally cost or have a monthly cost in addition to what you may already be paying for A and B, whereas most Medicare Part C plans in our area, like in St. Tammany, New Orleans, Jefferson Parish, don't have an additional cost, but you do have to continue to pay your A and B premium in order to be eligible for one of those plans. And I'll just mention, it wasn't mentioned here, but when the previous speaker, when she showed the Medicaid card and the Medicare card, there's always a lot of confusion. Folks don't know which they have. One way to identify was with Medicaid, those last 3 words, aid, generally means that you're getting additional help. You have a need where you have to get some additional help for whatever reason. So that the aid is for folks, like you said, it could be either income-based, it could be based on disability. There's certain criteria that would make you eligible. Medicare also is like health care. So this would be your health care coverage once you enroll in Parts A and B through the federal government. So that's just 2 different distinctions. Some, those words get, thrown around, and it's very confusing. So a few advantages of Medicare Part C. It offers the same coverage as original Medicare and may feature additional coverage. So any of the Medicare Part C plans that are out there, they have to cover what Medicare covers. They are allowed to add benefits, but they're not allowed to take any benefits away. It can include medical and prescription drug coverage in one plan, also known as an MAPD. It may have lower out-of-pocket costs than original Medicare. Okay, so these are some of the different types of Medicare Advantage plans. You have HMOs, which is basically a large network of providers, and generally you stay within that network, and that helps keep the out-of-pocket costs in check. We also have PPOs. The PPOs have a large network of healthcare providers, and it gives you the flexibility where you can go out of network. When you go out of network, you tend to pay more for care, but it just gives you an additional option if you wanted to seek a provider that was not in the network. And then there's also private fee-for-service. This here, you have more freedom to choose providers, but a network arrangement may still apply. And here, providers must accept Medicare and agree to bill the plan per its terms and conditions. So prescription drug plan. So if you choose a Medicare Part D plan, it helps cover costs for your prescription drugs. Each plan with prescription coverage has a formulary, which is basically a list of drugs that are covered under your plan. You can select the Medicare Advantage prescription drug plan that has both medical and prescription coverage, which, like I said, that's the majority of these Part C plans, has all of that encompassed into one plan. But you can also purchase a standalone prescription drug plan. If you choose a Medicare Advantage plan without prescription drug coverage, you cannot also enroll in a If you choose a medical plan without prescription drug coverage, you cannot also enroll in a standalone PDP. So you're not required to enroll in a Part D, but again, there is a penalty for every month that you don't have. And again, usually what I see, most folks that waive that Part D or they don't want that Part D, it's because they don't want to pay the additional cost. But at some point, as we age and things happen, more than likely you may need a prescription. And so if you wait 4, 5, 6 years before getting that Part D, it's going to be much more expensive to go ahead and get that coverage added later. So this talks about the drug tiers. Generally on the prescription drug plans, you do have tiers of medication. Basically, each drug is broken out into a category and placed into a tier, and then depending upon where that drug falls, you would have a matching or correlating copay for that particular tier. So there are 5 tiers. Tier 1 is generally your preferred generics. Tier 2, generic. Tier 3, preferred brands. Tier 4, non-preferred. Tier 5, specialty. The specialty tier really talks to very expensive medications, for the most cases, or it could be medications that or compounds or require refrigeration, but there's, and that's usually where the additional costs come in when you're into a specialty tier. And so, some plans may include a 6th tier. So Medicare, am I going, did I go that way? Okay. Most prescription drugs and Medicare Advantage prescription drug plans have a coverage gap. This starts once you and your plan have spent a certain amount on covered drugs. So while you're in the coverage gap, you may pay more, you will pay more or a higher percentage of your prescription drug costs. So in the first, there's generally four different categories with some of these Advantage plans. And so in the first category, it may be a deductible. The deductible is where you pay out of pocket first. The second would be where you and your insurance carrier split the cost of the medication, and that's where you pay your standard copay up to a certain dollar amount. Then when you hit that dollar amount, you go into a third category. In that third category, you may pay a larger percentage of the cost of that medication, and then that also has a maximum out of pocket. If you hit that maximum out of pocket, then you usually go into a fourth tier, which is considered catastrophic, and then there's a different copay structure there. Medicare supplement insurance plans. These are also called Medigap plans. These work to supplement original Medicare and help pay some of the deductibles, copays, coinsurance, and excess charges that are not covered by original Medicare. And they're not limited to a provider network. Basically, as long as the provider accepts Medicare, they accept your Medigap coverage. Please note that a Medicare supplement is not the same as Medicare Advantage, and it can only be added to original Medicare. So special needs plans. So if you have original Medicare and at least one of the following conditions, you may be eligible to enroll in a Medicare SNP plan that offers coverage to meet specific needs. So a specific eligible chronic condition such as diabetes, heart disease, or a chronic lung disorder may make you eligible for one of these special plans. Medicaid assistance from the state, depending upon, usually there's different levels of Medicaid that you may have, and so depending upon what level of Medicaid you have, that would determine what additional assistance you might get through a SNP plan. And then thirdly, a need or expectation of needing care in a long-term care, nursing or skilled nursing facility, an intermediate care facility for people with intellectual disabilities, or an inpatient psychiatric facility for up to 90 days. So if you met that category, there's, again, a separate set of plans that you may be eligible for. It appears to be stuck. It's not going forward or back. Yes. Point it that way? Okay. All right. So these are some factors to consider when choosing a Medicare Advantage plan. First, cost. How much will you pay for premiums, deductibles, coinsurance, and copayments? Coverage. Does the plan include prescription drug coverage or other additional coverage? A lot of the plans offer, in addition to covering everything that is covered by Medicare, many of the plans offer additional coverage like dental, vision, hearing aids. We also have plans that offer free cost or no cost gym memberships at participating providers. There may be some additional incentives, like depending upon the plan, that may help members stop smoking, may help members receive meals after an inpatient stay. So it really is good to kind of compare plans, determine what your needs are, and see what plans, match up best with your lifestyle. Network. Do your doctors, hospitals, pharmacies, and other providers accept the plan? So if you're really tied to a particular physician or specialist, you want to make sure that before you join one of these plans that your doctor is covered under that plan. Because if you're accustomed to going to that doctor through Medicare, but they're not on the plan that you elect, then those services would not be covered. Convenience. Are you required to submit claim forms and other paperwork? Can you get prescriptions by mail? Health history. How often have you needed care in recent years? Do you have a chronic condition requiring ongoing care. And then future health. Your health may change. Consider what future medical needs might be. These are some helpful resources, Medicare resources, and a lot of this stuff I do have at the table in the back. There'll be some, brochures to tell you how to go ahead and contact some of these facilities if you wanted to get information. So I'm gonna skip past that. So anybody have any questions? No? No questions? All right. Let's see. And I will just since I'm up here and folks are paying attention, be careful with, a lot of our seniors get a lot of calls that they haven't asked to receive from, telemarketers trying to get them to change coverage, to, it can get to be very confusing. I would just say keep in mind that before you make or have a conversation with someone over the phone and give them your personal information, make sure you kind of go through some of those questions. It's always a good idea to have an agent or a trusted person that you can talk to before you make these decisions, because a lot of times what happens is when they get these calls and they go over benefits with someone, some of the things sound really, advantageous, but they may not recognize that if they switch a plan to get, a premium give back, they may lose their physician. Or if they switch networks, they may, so I guess what I'm just trying to say is just make sure that before you change or make a change to your plan, that you fully understand what some of the consequences may be, because unfortunately, sometimes seniors make plan changes over the phone, and then if they're outside of those traditional eligibility periods or enrollment periods to make changes, then they can get stuck in those plans. So what I primarily see is there may be a member who only goes to Ochsner. That is their favorite provider. And then they speak to someone on the phone, they hear one benefit that they really like, and so they make that plan change. Then 2 or 3 months later, when they go to their Ochsner doctor, they realize they've been put on a plan that excludes Ochsner. So it's really important to not make sudden or hasty decisions on the phone. You can always listen and get that information from the person that's calling, but then before you actually make a change, do your homework, talk to a family member, and just make sure that you're not putting yourself in a difficult position. So, and if anybody has any questions, yes, ma'am.
I have Medicare and Medicaid, but I don't ever remember receiving a Medicaid card. I started with Social Security when I was age 62. I'm now 77. Can I get a card? What is the procedure? Do I need?
So, like the lady that presented before, she showed there were 2 like separate cards. I think it said like Louisiana Health.
I got here late. Yes.
So yeah, but she can probably speak to that. But normally you would have a Medicaid card and you would have a Medicare a Medicare card, and then if you had a Medicare Advantage plan, then you would have a card for that. So that does get very confusing because people always walk up to the table and they give me all 3 cards. And so usually if you're gonna have all 3 cards because you're still gonna have Medicaid, you're eligible for Medicaid. You're going to have your Medicare card because you're eligible and enrolled in Medicare. But then if you elect to get on an Advantage plan, you're going to have your Advantage plan card. So if you're enrolled in the Medicare Advantage plan, that's generally the card that you go with. You may not necessarily have to present your Medicaid card at,
And just to add to that, there are different levels of Medicaid coverage. If you're only in one of our Medicare savings programs, the only Medicaid benefit you may be receiving from the state is assistance in paying your Part B premium. And if that's what you qualify for and are eligible for, that's not actually a card that you would receive in the mail. So it would depend on the circumstance, but if you're in one of our Medicare savings programs, that's not actually a card. When you go to the doctor, your Medicare pays for that for you, and we just help you. Instead of you paying $46 right now? What's the Medicare Part B premium? Something like that.
160.
It's at 160 something now. Instead of you paying that, we pay that for you on your behalf. Yes, ma'am. We're going to be in the back afterwards if anyone would like to speak with us, okay? All right.
So I would encourage anyone, if you're 65 or older and have Medicare A and B, if you're approaching that age, I have some, my personal information, contact information in the back, even if it's just to help you kind of sort through where you need to be. I had a couple of folks here that have People's Health. People's Health, Humana, we're competitors, but they're both very good plans. So if you're on either one of those plans, but I'm here today if you just have general questions, feel free to ask. If you get a call and you're just not sure, because it can be very confusing. I work in the industry and I still get confused. So it's no problem to pick up a phone and say, hey, because it happens all the time. Hey, I know I asked you this last week, but just to be sure. Because what I hate to see is that someone, isn't certain about something and they make a change and then it's detrimental to either their health, it's detrimental to their finances, because sometimes you make a move and you're kind of stuck in that until October 15th. So always feel free, I'm always out and about, so I may not respond to you at the same day, but I definitely will. You leave me a message, I'll give you a call back and try to, help you as much as I can. We usually have access where we can kind of go into different systems to see, if you have Medicare, if you have Medicaid, and then there's a lot of materials back there that are, where you can contact folks to find out what your level is. What Medicaid level you have. There's some Medicaid levels where you just get help, like you said, with your Part B. You may get help with just paying for an expensive medication that you have. So you want to find out what your level is, and we've been trying to educate and let folks know that that Medicaid is doing that recertification. So it's very important that if you get mail, I think it comes from, is it Department of Health? Louisiana Department of Health. If you get something from Louisiana Department of Health, read it. If you don't understand it, if you have an agent, call your agent. Call Medicaid, call someone. But I've contacted a few of my members to let them know that those notices are going to be coming out. And I've had a couple of members that said, oh, I got that the other day, I threw that in the trash. Do not throw it in the trash. Do not. Look at it if you don't understand it. Get with someone who does understand it, because some of the requests are very simple requests. And you can get on the phone and I think verify the information, give them your right address, whatever it is. But please don't throw it away, because what we don't want to happen is if a member loses their Medicaid status because they have not followed that certification or they have not given that additional information, if you lose your Medicaid status, then you can no longer have the plan that you're on if your plan requires you to be on Medicaid. So you really want to pay attention to any mail that you get from the Department of Health, Louisiana Department of Health. Open it. I have folks, they text me the letter saying, what do I need to do? And it'll literally say, you need to. But, just, trying to get that message out, because we would hate for someone to lose coverage and then have to recertify. I mean, it would be a major disruption in getting your medications and getting your health care. So please make sure that if you're getting that type of mail, if you know someone who is on Medicaid, make sure that they're aware that these notices are going out. It's imperative that they respond and keep their Medicaid in check. Any other questions?
Thank you again, Ms. Monet. We have covered Medicaid, Medicare. We all understand that there are a lot of benefits out there that you can take advantage of. We now want to kind of talk about the wellness side of the house. And one of the important parts of wellness is your mental wellness. And so we're going to have, from the Canopy Counseling and Consulting Services, Ms. Stacy Williams Whiteside to share some information with us.
I was this short. Good morning. A lot of information. It can be very confusing. But what I'm here to talk to you about is a specific resource that is covered by both Medicaid and Medicare, and that is mental health and psychiatry. So basically, there are different levels of mental well-being with Medicaid and Medicare. It all depends on what your needs are and which plan you have. For example, Canopy is my private practice. I take 5 of the 6 MCOs from Medicaid. I also take private insurance and self-pay. I do not take Medicare. Then on the other side, I help run what is called an MHR. An MHR is called a mental health rehab, and basically what it is medication management, counseling, as well as community support. Some MHRs take Medicare, some MHRs take just Medicaid. We take just Medicaid. This is covered by both, but due to guidelines, like I'm an LPC, so currently Medicare does not cover LPCs. It is currently in the White House to get approval for coverage. So it's important that you understand, because we get people all the time who will start with our MHR and have Medicaid, but then at some point get Medicare. When you have dual insurance like that, and dual Medicaid versus Medicare, certain providers, including your private care provider, may only take one, or you may have to be discharged because Medicare will become your primary, Medicaid will become the secondary. Again, it gets a little confusing, but it is important to understand this because this is an underutilized resource in the Medicaid and Medicare community. We have people all the time who may go to their primary care doctor and come get diagnosed with a terminal illness and need to seek out counseling or need psychiatric medicine that their primary care doctor cannot provide. So with Canopy, we offer what is called a continuity of care agreement, where we work with your primary care physician directly, where we can give you the counseling, but they will continue the medication. The MHR is kind of all-inclusive for all of it. So I guess most of the other stuff is covered by Medicaid and Medicare. I just wanted to put that out there. If you need counseling, please check with which program you have. If you have private insurance with Medicare, some, like our MHR, which is called Abundant Health, I know some of you may have heard of it, does not take that, but we do take all Medicaid. If you do need help and you only have Medicare, I can direct you, point you in the right direction. Trying to think. Most of the other stuff has pretty much been covered. I don't want to go too much into what is covered and what is not. Waiver services. I mean, I think that's pretty much all I have to say. I'm sorry, y'all. Everything else has been kind of covered.
Thank you again, Stacy. Okay, now we're going to have a representative come with us from Austin to share some information on wellness. Thank you.
Yes, hi. I'm so glad to see people that have come out. On behalf of Auctioner, I'd like to reach out to our community to know that we too have services. The ladies that spoke about Medicare, Medicaid, it's all about a plan, and that's so important that we have a plan. Knowledge is power. Empower yourself before there is a problem. And with that, I'd like to remind us to get our cards. When you have your cards, take pictures of them. In the heat of the moment, when you come to that ER, you're emotionally driven, you're ill, or you're bringing someone that you love that is ill. So that we don't always think about grabbing those last minute things. So make sure to take pictures of these cards. They may get lost, they may get damaged. So it's good to have that picture because you still have those numbers. Also with that, get some baseline data while you're healthy. Go to your doctor, get an EKG, get some blood work done, so that when you are ill, you have something to refer back to. This is where my baseline is, and this is what's going on now, because we're all different. Also, with a plan, I'd like to address the advanced directives. When you go to the hospital, they'll bring that up, and what it is a plan. It's your ideas, your instructions when you are ill and possibly too ill to speak for yourself. There are many different plans. It's best to do that while you're not sick. Also, it's, like I said, it's your decision, it's your choices, it's your plans. Health is your wealth. It's also your independence. So maintain it and preserve it while you have it. That's about it that I have. But thank you for asking us to come out. I love this. I'm passionate about nursing. I like to say nursing isn't what I do, it's what I am. So thank you very much.
All right, guys, let's give everybody a round of applause. I want to thank all our presenters. At this time, we're going to start our Q&A session. If you have any questions on a card, or if you just want to get on the mic, just please feel free to raise your hand with any questions at this time.
I still have my old, I guess, original Medicare card, and there is a new one, I guess, that I never ever received, because I've basically been very, very healthy all of my life until an automobile accident about 2 years ago.
Okay.
So I can show you that card, and you tell me what I need.
So one or two things, you can probably reach out and they will send you, request a new ID card, and they'll send you a new card that has the new number, or you can stop by and see me before you leave, and I'll log into the system, and I can tell you what the number, I can probably tell you what the number is, you can write it down, but then you may still want to go ahead and order a new card.
Okay, thank you.
You're welcome.
Thank you, sir.
I recently read that you can't have an HSA or flexible spending account if you have Medicare. Is that true?
That I'm not certain of. But I could probably find out for you. Just meet me in the back, and I can get some information. I'm not certain on that. And I
Thank
would just
you.
say one of the like she was kind of mentioning some things. I meant to do this earlier, but I didn't. Just to give you a little feedback about myself. So I have been doing Medicare Advantage sales since June of last year. So I'm new to the Medicare Advantage world. But prior to doing that, I worked for about 20 years on employee benefit side. So, and when doing that, I basically did customer service. So I'm very passionate about making sure that people are treated fairly and that people are utilizing the benefits that they have and that they're being taken, that they're not being taken advantage of. I get in trouble a lot of times because my job is to sell, but I do spend a lot of time helping people resolve issues or helping people get things done. Because I mentioned to some ladies earlier, I have a grandmother that turned 90 in January, and I have a great aunt that just passed. She was 101. And so whenever I'm talking to seniors or I'm talking to people who are trying to understand, I try to envision that I'm trying to explain this to a 101-year-old person who, when, she was a 20-year-old, some of this didn't even exist. So I'm very passionate about making sure that people are on the right plan, that people understand how their benefit works, and then also making sure that they're not taken advantage of. Sometimes it's just a phone call. I spend a lot of time helping seniors make phone calls to providers' offices or to shore up claims and things, or help them, get their Medicare cards, because it is very confusing, and I find that a lot of seniors, if they're not understanding or they don't know what's going on, they just don't want to deal with it. And then what happens is their health fails, They're not taking their medications because they couldn't get their medication. When there was something as simple as you couldn't get it, you know, it could be the simplest thing, like your address wasn't right or your birth date was wrong in the system. But, you know, they're just, you know, so again, if you are with Humana and you just have questions, or if you're with People's Health and you just have questions about how things work or you're just navigating, I always give my card out. A lot of times I can't answer your question, but I have the resources and the contact names and the numbers to get you where you at least need to be. I spend a lot of time talking to children of some seniors because they are in a lot of cases, they're the ones that are doing the caregiving. They're the ones that are taking them to the doctor's offices. They're the ones, you know, in some cases maybe helping them pay co-pays. So I am very passionate about making sure that people are enrolled and taking advantage of these benefits. I mean, if you work your whole life and now you're retired, you should not have to worry about whether or not, you know, you can get your medication or whether or not you can get to a doctor's office. So, you know, feel free to utilize me, call me, and I'll do whatever I can to help.
Hey, Ms. Monet, while I have you here, I just have one quick question. What do you recommend, you know, how they get these phone calls from different places, they're trying to sell different plans? Do you have a recommendation on how you can be prepared so you can kind of have an idea of what you're looking for?
Okay, so what I recommend is that you do not talk to these people. If someone calls your home and you do not know who they are, do not talk to them. If they're calling from wherever, I don't know, don't talk to them. If you answer your phone, you know, people are like, oh, I hate to just hang up. Now, some folks, unfortunately, we have a lot of seniors who are lonely and they're isolated and they take those calls for conversation. They take those calls because they haven't had a person call them to say how you're doing, and then next thing you know, they're in a whole new plan. But my advice would be not to call them. If you're seeking information or you want information, then you should pick up the phone and call a trusted Humana rep, People's Health rep, Medicaid rep. You should do that. You should not let anyone call you and say they're from wherever and that they want to sell you anything over the telephone. That would be my recommendation, because we have a lot of local reps here, but you can always go to a website and call. Now, if you see a legitimate Humana commercial, legitimate People's Health commercial during that season, call those numbers and speak to those folks. But if anyone is calling your home unsolicited to make you or help you make a change that you didn't even know you wanted, you know, 5 minutes ago, I would just say not to speak to them and find you a trusted source. These types of health fairs are happening all over, and especially during that time, you can go anywhere in the city and find information. You can go to doctor's offices, you can go to churches, you can go to, I mean, there's so many places where you can get the information. I would just say do not make a change or speak to strangers on the phone when they call your home, because they create a lot more problems than solutions.
Yeah, and I just kind of echo that. I know that we're living in a technology age where technology is so advanced. Well, you just have to be careful. I think sitting down face to face with a representative or agent helps you to develop a relationship with them, gets you more comfortable with them, where you can ask them certain questions that you ordinarily wouldn't want to ask someone that's calling you over the phone. Any other questions?
Thank you for coming. When you become Medicare eligible, hopefully I'm not working, but if I'm still working at that time, is it still advantageous to keep your private insurance as well?
Again, that is a case-by-case scenario. So, and that's why I encourage folks to just at least have the conversation, because if you're working for a company and you turn 65, and most folks will get their Part A, a lot of times they don't have to pay for it. The Part B, you generally have to pay for, so some folks will postpone that, because if you are working for an employer, I think it's 100 or more employees or whatever, you can have that coverage. It'll be like your primary coverage, but you don't have to take out the Part B if you have credible coverage elsewhere. But, and so some folks will say, well, I'm just gonna stay there. But it just depends. So if you're working for an employer and you're paying $386 a paycheck to have that company coverage for you and your spouse, let's say, but you're eligible to get A and B, whereas with B, you might pay the $160, and then you could get a Medicare Advantage. I mean, you just kind of, each situation is different. I have some folks, that say, oh, I have a what is it? I have a retiree plan. I have a retiree plan. So I'm like, let me see your retiree plan. Sometimes a retiree plan is garbage. Like, it's like you have this retiree plan, but you have to pay this amount out of pocket. You have to pay, so sometimes it's a numbers game. You may save money and have more benefits. A lot of times with employers, you pay a portion of your your medical. Then if you elect dental, you pay a portion of that. If you get vision, you pay that. So in some cases, it might be more advantageous to pay your Part B premium, get on a Medicare Advantage plan, and have coverage for medical, dental, vision, free gym membership, and all the other benefits that come with it. So it really is a matter of, with anything, making an informed decision and comparing the benefits, as opposed to, I worked there 25 years and they're giving me retiree benefits, because sometimes those retiree benefits are not rich benefits. They do offer you benefits so that you don't, I guess, have a gap, or that you have some type of coverage, but you may have other resources or other benefits that are available to you. So it's always just worth looking at. It's always worth looking at.
I have one other question. Before this accident, I had two doctors that I got physicals, got checkups with. Now, with People's Health and Humana, if you already have doctors, do you have to select doctors that are from a list, or is your physician accepted? You understand what I'm saying?
I do. So what
Okay.
you're going to want to do is confirm that the doctors that you're seeing are in the network of the plan that you elect. So if you decided you wanted to go with Humana and you see Dr. A, B, and C, you want to make sure Dr. A, B, and C is on our plan. If Dr. A, B, and C is not on our plan and you want to be on our plan, you would have to make a change. If you don't want to change those physicians, you can keep those physicians, but, and there's options. You can do the HMO, which gives you a restrictive network where these are the only doctors that you can see. You can do a PPO that gives you the option to go in and out of network. But yes, if you are on a Medicare Advantage plan, you generally have a network of providers that you have to see. Now, I will tell you that Humana has a very large network, so it's more than likely that your doctor is somewhere in our network.
Yes, I have a question. For veterans that may not have 100% disability, how do they qualify for any of these type of programs, as far as, Part A, Part B, D, because there's not a representative here for the military, so.
I'm honestly not certain. I can tell you that if you have Medicare and you are with the VA, you would be eligible for a Medicare Advantage plan. Now, if you're not Medicare eligible, then you wouldn't be eligible for the plans that we offer. But if you're eligible for Medicare and you have Parts A and B, and you go to the VA, you would be able to get onto a Medicare Advantage plan.
Just for a clarification, if you're 100% veteran, which means that the VA takes care of all your medical needs, do you still need Medicaid and Medicare?
You would need Medicare. So you don't have, so the way that our plans work, you have to have Medicare, you have to have Medicare A and B to get on a Medicare Advantage plan. And so the key word there is Medicare Advantage. You have to have Medicare to get on a Medicare Advantage plan. You don't have to have Medicaid. And then if you only have Medicaid, you're not eligible for one of our plans. But if you are eligible, if you have Medicare, Parts A and B, and you are going to the VA, or like you said, 100% coverage to the VA, you would still be able to enroll, because what would happen is, instead of just having that original Medicare, your Humana plan would then, it replaces it. So you would now then go through Humana for your services, and then you would still have the option of going to the VA.
Is it the same as TRICARE for life? If you're veteran.
So we do have folks that have TRICARE that may have a plan, but generally, the general rule is that if you have TRICARE, so TRICARE works a little differently. TRICARE almost works like the Medigap supplement. You go through, I guess, Medicare, and, you know, and then TRICARE picks up maybe like what Medicare doesn't pick up. So, you know, the folks that are on TRICARE, from what I understand, you know, you're like in the best spot. But we still have folks that, you know, elect to get on our plans because they want the free gym membership. They want the Go 365. They want some of the additional perks that may come with the plan. The only thing that they really have to keep in mind is you may have to make sure that your provider is aware that those claims have to, so what happens is Humana becomes your primary insurance carrier, and then TRICARE is your secondary insurance carrier. So your providers have to be willing to file the claims for you in that manner. They need to be able to submit it to Humana, get it back, then send it to TRICARE. So that's I guess the biggest difference there.
Any more questions from the floor? Okay.
So what you're saying is if you are 100% covered by the VA, you still are eligible for Medicare?
Yes, if you're 65 and older and meet the Medicare requirements, yes. And then if you have Medicare A and B, even if you have VA coverage, you could elect a Medicare Advantage plan. And they work separately. So a lot of folks that I have that have the VA, they still do everything through the VA. They go to the VA for everything, for the prescriptions or whatever. They may come to us for a second opinion. They may come to us, like I said, because they want the free gym membership. You know, sometimes they use it. We do have a plan that is geared for members that have VA coverage, and that offers some, you know, additional benefits that may not be on another plan. But again, I always just encourage folks, you know, give me a call. We can see what you have. We can compare it to, and it's also about looking at what services that you receive. You know, a lot of the folks that get on the plan, they're perfectly healthy. They just want some of the additional benefits. They don't generally go to the doctor. They go to the doctor once or twice a year, and when they go to the VA.
Right. So if you're covered 100% by veterans and you have Medicare Advantage coverage, you should be covered all the way.
Right. You definitely have coverage. The difference is just whether or not you want to just have the Medicare A and B, or if you want to join Humana and have the Humana Medicare Advantage plan with those additional benefits, but you still have, you don't lose your VA coverage or status. You would still have the ability to use both.
Okay. Any other questions? Okay. Thank you. Thank you, Ms. Monet. Okay. I have one announcement I wanted to make. Walmart today is hosting a wellness day from 10 a.m. to 2 p.m. Customers can receive free health screenings for things like glucose, cholesterol, body mass index, and blood pressure, as well as affordable immunizations like flu, COVID-19, shingles, tetanus, measles, and others at their pharmacy. This is a nationwide event that Walmart is hosting today from 10 a.m. to 2 p.m. Okay. We're now going to have remarks from our president, Don Thanars.
Good morning. The mission of Alpha Phi Alpha is to develop leaders, promote brotherhood and academic excellence while providing service and advocacy for our communities. This is the service and advocacy for our communities. This was a very important topic at the beginning of the year, and you know, I'm getting closer to 65, you know, starting to have these discussions with my wife, and I just realized that you know, this discussion is probably being had by a lot of folks. You know, we've got an aging population, and as Fabian mentioned, you know, technology is a big thing today. Well, a lot of the older folks don't necessarily have it. Some of these benefits that are offered weren't available. They may not have access to computers and the way information is transmitted these days. So we needed a mechanism and a forum, you know, where folks could come face to face, talk to people, see people, and get real information so they could make real informed decisions. And this is our first effort at this. So we appreciate you all coming out. We appreciate you and hope that you would share the information, take extra pamphlets, flyers, contact information, and so that folks, when they have these real questions and making some life decisions, you know, they can get the right answer to their questions and make an informed decision. Very, very important. There's also folks, as you know, Asian population. My mother is 90 years old, be 91 in August. So, you know, my sisters and I, we generally kind of take care of her, transport her to the hospital, make sure she gets to our doctor's appointments, make sure she's taking her medications, and all these things. And if you don't know what you don't know. You know, so you have to have these conversations, and then things change over time. Things change over time. So again, it's very, very important. And one of the things, especially for our folks, we're often saying, you know, we get left out, we're uninformed. So these opportunities, these forums are very important so that we can come out and get the information for ourselves. And then we want to just not keep it, we want to make sure we share it. So again, I appreciate you all on our presenters to come out and on our behalf and, you know, provide this information to our communities. I appreciate all of you coming out. And again, we know we have bad weather. We don't pick the weather, you know, but we still, you know, we're glad that you braved the weather and came out to be a part of this. And then lastly, I want to thank our pastor. Pastor has been very supportive of all of our endeavors over the years, and we appreciate him coming out to be a part of this event today. And let me recognize Brother Fabian Clay. Brother Fabian Clay, also a member here at Living the Word, for his efforts to put this together for you all. You know, we want to thank him. Let's give him a round of applause, please. Let's give a round of applause to our presenters. Thank you all, and be safe on your way home.